My name is Melody. I'm from California, cohort 39. A nursing situation that I encountered this week was with a 75-year-old male admitted for hyponatremia. He recently had a transsphenoidal surgery of a sellar mass and has a medical history of type 2 diabetes and prostate cancer. He was diagnosed with SIADH and sent by his primary because his sodium level was 128 on admission. On the day that he was my patient, his sodium levels was a determinant whether he could be discharged. However, when the results came, the level was 133, which the doctors were still not comfortable with. The endocrine team came and spoke to the patient about controlling his blood sugar, which was fluctuating between 150s and 300s. They believed if his blood sugar was controlled, there would be less diuresis, therefore retaining more sodium. My relationship with the patient was that of a new patient. I've never previously taken care of a patient with SIADH or hyponatremia, so I had no prior experiences to guide me. I believe my role as a nurse in this situation was to monitor his sodium and blood sugar, any headaches he may experience, or altered level of consciousness. Initially, I noticed that the patient's blood sugar was fluctuating around 130s to 200s during the day shift, and his sodium level was still low. He was still producing a lot of urine, even with a fluid restriction. Before we left that day, the doctor ordered a stat 3 units of Lispro on top of his sliding scale. The next day, the night nurse reported that his blood sugar went between 250s to 400s and was finally controlled at 200s in the morning. I thought this situation was very interesting because, like the doctor said, as we controlled the patient's blood sugar, his sodium levels slowly climbed to 139 before he was discharged. Other information I needed in this situation were his lab values that were collected every 6 hours and assessment of the patient to see if he was having any symptoms. My data interpretation led me to believe that his sodium was retained once we were able to control his blood sugar. My goal for the patient was to control his blood sugar and monitor his sodium levels because him and his wife were eager to be discharged. Trying to maintain the patient's blood sugar but having it increase every check was a stress that I experienced in this situation. The patient and the family were very understanding. His wife was a nurse, so she was trying to understand the situation by asking a lot of questions and explaining it back to the patient.